All right. Hello, everybody. Thank you for joining us today. And I'm pleased to introduce our speaker for this session, Beyond the Reading Room, Leadership Opportunities in Radiology and Building Long-Term Career Success with Dr. Jennifer Nathan. And with that, I'll hand it over to you, Dr. Nathan, for your presentation. Thanks for being with us here today.
Thank you, Holly. So again, my name is Dr. Jennifer Nathan. I just want to give you a little background about me. In terms of my training, I went to medical school at Medical College of Ohio in Toledo, Ohio. I continued on to do diagnostic radiology residency at Case Western Reserve University in Cleveland, Ohio. And then I did my fellowship in neuroradiology at Johns Hopkins in Baltimore, Maryland. So on behalf of the American College of Radiology, and specifically the Radiology Leadership Institute, I'm going to do a brief talk today, as Holly had mentioned, on leadership and opportunities you can do to build long-term career success. So let's go ahead and get started. So leadership, I think when we think of the concept of leadership and what your definition of a leader is, I think you all would have very good insight onto what a leader is and be right on point. I wanted to just briefly go through a few things that I consider and what I think of when I think of a leader. So number one, the person that calls the shots in decision making. And by this, I mean the person who, even though you're a committee or a group setting, individuals give their opinions or perspectives about things. And ultimately, the leader is the one who makes the final decision and does the final call. Secondly, the leader is the person a group or committee, et cetera, looks to for guidance. They're perceived as an expert and they've already made good decisions in the past, and they are the person they look to for kind of manning the ship. And lastly, and I think this is probably the most important concept that I think of when I think of a leader, is a person who inspires others to be successful in a task. And so by that, I mean, being a leader doesn't mean taking credit all for yourself or, just getting things accomplished. It means being able to inspire others and to help them be successful and also to go on to be future leaders. So let's talk about some leadership traits. Positive versus negative. And here I have listed on the, you can see a cursor here. On this side of the screen, so it'll be on your left-hand side, are my list of positive traits. And then on the right-hand side of the screen, you will see my list of negative traits. So I'm sure all of you have seen different types of leaders, good or bad, and you've exhibited or already seen some positive or negative traits in those leaders. So I just want to briefly go through my list of what I consider to be positive versus negative. So in terms of positive leadership, by that, I mean a person who is very passionate about something. More importantly, they have integrity and honesty. You can trust them. When they say something, they do it, as an example. Their selflessness. So they are more concerned about the group or initiative being successful than perhaps their own careers, etc. They're a good communicator. So they're very well at stating what the goals of a group are, what the next step should be, and the group understands where they should be going. They also have clear goals in mind, and they are team builders. So they are able to get people to be cohesive and work together. Negative traits. So just some examples here. An individual who's a bad communicator, the group or committee, et cetera, does not understand where the group's supposed to go, what the initiatives are. Perhaps the leader has not been very kind of wishy-washy, going back and forth, so there's just no direction. They're vague, they're confusing, they waste time. They allow problems to fester. If there's a problem, you should immediately address it and resolve it before it snowballs into a bigger issue. They create a fearful working environment. Perhaps people don't feel that they can speak about what they really think, or when they see issues, they're not willing to speak up and point it out to the group because they're afraid of speaking up. And they don't apologize. So they think that perhaps what they're doing is correct, even if it's already being shown that there's some issues with it. If they are shown to have made a mistake, they will not fess up to it, so to speak, and admit to a mistake, and they continue to think that what they're doing is correct. Also being a bad listener, I think that goes in hand with communication. Listening to your group, being able to understand their concerns is what makes you a good leader as well. So why is leadership important? You're going on to become a physician and a doctor. So why should you care about leadership? And I think that you'll find that throughout your career, leadership is essential. And it's something that you're going to use regardless if you go on to be a CEO of a hospital or if you're just practicing in a community setting, treating patients. And I really like this quote from Theodore Roosevelt, one of our past presidents. And he was quoted as saying, "Do what you can where you are with what you have." And I think that's really important, specifically in the leadership setting, that no matter if you're in a high academic practice, if you're in a community setting, if you are a CEO, if you are on just a committee for a hospital, it doesn't matter where you're working, what setting you're in, use the resources around you to help build your leadership up and to be able to improve your career. So I do have quoted here, this is the American College of Physician Executive Reports. They had a report that came out where they essentially discussed that 5% of hospital CEOs are now physicians. I think that's a really important point, and I bet that number has actually increased more recently. It's important to know that the people who are in charge of medicine and the healthcare system are not necessarily business people anymore. Physicians are getting more and more of a niche in this arena. And I think probably part of the reason for that is that we are moving towards a more value-based system. So physicians' perspectives and opinions are becoming more and more valued, and we're moving more and more up in leadership ranks. So how to become a successful leader? So I have some basic strategies listed here that I wanted to mention. So first of all, make sure your expectations are clearly known. When you're in a group setting or running some sort of initiative, make sure everyone understands that you're working with what you are expecting in that initiative. Share your goals, visions, motivations, and why you believe in them. It's important to be very transparent, to state where your direction is. And I think by doing that, people will trust you more and it will help the group be more cohesive and work better together. Give feedback about contributions, whether you think the contributions are good or bad. Make sure you either support good contributions and say, great job, or if you don't necessarily agree with something, give some constructive feedback for why you disagree, or maybe an example of what we should be doing instead as a group if you don't agree with that initial initiative, what would be a better way to do things. Be a good listener. It's always good to listen to your team members and understand all of their opinions and perspectives. You want to build team playing. You don't want to have a divisive group. You want a cohesive group. Reward cooperation. You want people to work together. Maintain good relationships with your superior. And that's so essential because if you do not get along with the individuals who are above you, it's going to be very difficult to get your initiatives and goals accomplished. Accept diversity. Everybody has their own opinions, and that's a good thing because you want diversity and being able to solve problems. Admit mistakes, and I think that this not only applies to leadership, but for a practicing physician on a day-to-day basis. You at some point in your career will feel like you made a decision that didn't work out, and it's important to not only feel, you don't have to feel bad about it, I guess, but just accept that it was a mistake and learn from it so that you can become a stronger physician or leader in the future. When you make promises, deliver on them, and I think that's really important that people trust you and see you as a person with integrity. Okay, so one thing I wanted to briefly mention is mentorship. And as you progress throughout your career as a leader, it's important for you to develop mentors. The mentor is someone who's going to help guide you and build your career with you and help to make you successful and bring you above where you already are. So I did put up some characteristics here for what I suggest that you look for a mentor. And I think probably the most important thing to look for in a mentor is that it is somebody that is where you want to be in about 5 or 10 years down the road. It's somebody that you strongly admire, but has characteristics for the type of physician or leader that you want to be. So look for somebody who's experienced, who is further along the pipeline or further along in their career than you, because they're going to be able to give you good feedback on what did or didn't work for them and help guide you in the right direction. You want somebody who challenges you, that isn't just a yes person that says, oh yeah, that's a great resume. Oh yeah, that's a good idea. You want somebody that says, oh, well, that's a good idea, but something I think you need to think about is this, or maybe you should try this direction instead. I'm not sure that will work out because that didn't work for me in the past. Where you see yourself, again, that mentor wants somebody you want to be in the future, gives constructive feedback, listens and is supportive. So now what I'm going to do on the next few slides is we're going to go kind of through the different stages of your career, starting with where you are right now as a medical student. And we're going to talk about different things that you could be doing to build yourself as a leader and develop these skills. So we're going to do medical school stage. We're going to do training with residency and fellowship. Then we're going to do early mid-career physician when you're already out of school. And then the last stage will be the seasoned physician when you've already kind of gotten to where you want to be. So let's start now with the medical student stage. So as you all know, this is a very tumultuous time in your career. You are digesting a large amount of information. You're getting the foundation and base of what it takes to be a good doctor. You're taking boards, and you're also trying to figure out where you want to be in your career. Do you want to go into internal medicine, dermatology, etc.? So it's a really tumultuous time, but there are still things that you can do that don't take up a lot of your time that you can use to start building yourself as a leader in the future. So just a few ideas that I bullet pointed here that I did. So when I was in medical school, I served as the Officer of Legislative Affairs for the AMA chapter. And I think this is something you could consider. I think most medical schools do have a chapter for the AMA or the double AMC. So look at those organizations and see what leadership opportunities you could consider volunteering for. And I can say in the role that I did, I basically created a newsletter that I put together, I think 4 times a year. So it didn't take up too much time, but that newsletter I used as a mouthpiece to give my fellow medical students updates about political issues and bills and things like that. So it didn't take a lot of time, but yet was a leadership experience for me. Another thing that I did was I was director of the Community Health Project, and that was a project that we had at my medical school where I basically placed my fellow medical students into various social service agencies like a diabetics clinic, homeless shelter, eating disorder clinics. It was an opportunity for me to serve as a leader, understand personalities of my fellow medical students, know where to place them, and kind of deal with different issues that occurred during the project. Some other things you could think about is look at your other clubs or organizations. There may be an internal medicine club you're interested in, or surgery organization you're interested in your medical school. If there is nothing like that, consider starting your own club. Also consider running for the executive committee or student council. Most medical schools have such a thing. At my medical school, we had a 7-member group as a student council. So I'm sure that there's something similar to that at other medical schools that would be a good opportunity for you to learn leadership skills. If you're interested in research, consider leading a research project that will give you the opportunity to develop ideas, work with a group to help accomplish a goal. You could also consider volunteering for the Office of Admissions. That's something I did, where I was involved with meeting prospective students, taking them on tours, providing the Office of Admissions feedback on what I thought we should be looking for in potential candidates, and giving my feedback about the different candidates that we had interviewed. You could also consider grand rounds. That's an ability for you to present a case that will allow you to practice public speaking. People will likely be asking you questions that kind of puts you in a hot seat for being able to kind of quickly think as a leader would think in different situations. And lastly, find a mentor, somebody you want to perceive that you want to be like in the future. The next stage of your career is a resident or fellow. So this is again another tumultuous time, although you have already kind of selected your path, so you know what you're going into, what kind of position you're going to be. You're taking boards, you're now on call, you're studying still. So it's also a very tumultuous time. But again, I think that there are other things you could consider to do that don't take up a lot of your time that will help you develop these leadership skills. So consider getting involved with your respective specialty society. For me as a radiologist, it's the American College of Radiology. I got involved with, we have several different committees and commissions that I got involved with. I got involved with task forces. I also got involved with our local state chapters that we have as part of the ACR. But these are just some examples of what I did in terms of the ACR. But most specialties do have their respective society, like the cardiology, ACC, the Cardiology Society, for the dermatologists, there's this respective society. For each of these societies, there's different leadership options that you have. And so I highly recommend that once you have chosen your path and you're a resident fellow, consider contacting the society or looking on their webpage to see what you can do. Consider volunteering to serve in your community. There's tons of leadership opportunities, may not be medically related, but there are opportunities that you could practice being a leader. Consider running for chief resident. This is a great leadership opportunity, working for a group of people, doing scheduling, dealing with interpersonal conflicts, things like that. Great leadership opportunity to serve as chief resident. Also, if you're interested in research, again, lead research initiatives and present in conference. And lastly, find additional mentors. The mentor that you had as a medical student will likely not be the type of mentor that you're going to need as a resident or fellow. So it's important that as you go through these different stages to maybe add more mentors or change your mentors that you have to different ones. The next stage of your career, so you have finished training, you are now out and you're practicing physician, you're in your early or mid stage. So at this point, you're still kind of in a little bit of a tumultuous period of your career. You've learned your trade, you've passed your boards in theory, you know, you're moving ahead, but now that you're out, you're trying to establish yourself. So you're trying to establish yourself perhaps in the group or practice that you're a member of. You're perhaps trying to establish yourself on a national or international level. If you go into academics, you want to be known as a good speaker. So, you know, this is really a period of your life where you're really trying to get yourself, you know, established and find a niche for yourself. But during this period of your career, I think that there are still things that you could consider that will continue to kind of develop your leadership skills already on the base that you've been developing as a medical student and as a resident or fellow. So consider volunteering for positions in your group or practice. In radiology, we have all types of leadership opportunities like chief of nuclear medicine, chief of MRI, chief of neuroradiology. Consider potentially volunteering for those, or maybe working with the current chief of that group or that specialty that could groom you to potentially be a leader of that in the future. Increase your involvement in specialty societies. So like within the ACR, I got involved with committees and commissions, and then I ended up going on to become part of what we call the Council Steering Committee, representing the voting body of our group. And then I went on to do Board of Chancellors, which was basically the group in the ACR that developed strategic planning. So during this period of my career, I was moving from the base that I had established in my society, moving to higher leadership roles. So beyond like society type things, you could look locally and get involved with hospital boards and committees, like outside of your department. So that's other leadership opportunities that you could consider. And lastly, again, modify your mentors. So again, likely the mentor you had as a medical student or resident is being changed, that your goals for your career and where you want to go has been altered. So you need a different mentor at this point. The last stage of your career is when you are a seasoned physician. So you've already been through the training, you've established your niche, you are now known as the expert, thanks to all of the experience you've developed and all the leadership building you've been doing. So now that you're a major player in societies and committees and boards nationally and locally, it's time for you to give back. And so I highly encourage, once you're in the seasoned stage of your career, to reach out to maybe the local medical school or residents that you see out in the hospital and try to teach them or mentor them about things that you learned as you were going through this process. So I want to just kind of briefly mention something that is not necessarily leadership related, but I think it is so important that you are aware of, because this is becoming increasingly prevalent amongst all physicians, and that is burnout, also known as physician wellness. And what I have posted here on the screen, if you look to the left, this is an actual graph of a study that was conducted by Medscape. It was a survey they did a few years back, and they surveyed all different types of physicians. And as you can see here, it's a pretty broad spectrum, starting with public health, preventive medicine, dermatologists, psychiatry, OBGYN, radiology, all the way to urology. So basically, they surveyed a broad spectrum of physicians, and they asked them in the survey if they felt burnout. And as you can see, the lowest percentage of physicians on this graph is the public health and preventive medicine. 28%, nearly 30% of those physicians felt burnout. If you look at the highest, the urologist, that's at 54%. So as a physician, when you get out, there is anywhere between a 30 to 50% chance that you will develop burnout. So it's prevalent. And so I want you to be aware of the symptoms of burnout so you can better cope with and prevent it. And as you'll see on the right hand of the screen, these are some of the symptoms of burnout. So it can include things like mood disorders type situations, like you're developing some depression, perhaps anxiety, substance abuse, alcohol or drug use, broken relationships. And that could mean anything from friendships to family members to significant others, but impaired relationships with people. Disillusionments, perhaps what you start out with, the passion that you felt for medicine, you're now feeling disillusioned by, and you're not sure it's really there for you anymore. Denial, you maybe are experiencing some of these symptoms, but you're not willing to fess up to the fact that maybe you are having burnout. Avoidance, and that could be just so fed up with your job that perhaps you're stepping back from leadership roles, interacting with clinicians, whatever it could be, maybe taking more vacation time. Again, another symptom of burnout. And I think this is probably the worst, because it's not only affecting you, but affecting others around you, but lack of attention to detail. If you have that, then that means you're not paying as close attention to taking care of your patients, and ultimately could affect their health. So just some examples of symptoms of burnout. So what can you do about it? Well, this slide, I have some solutions. So if you look on the left-hand side, physician wellness, I broke it down to individual and healthcare responsibility. So individual, look at yourself. What can you do to make your life better? If there's something that you're unhappy about with your job that you feel is creating burnout, perhaps try to figure out what it is that could make you happier. Would you rather do more teaching? Would you rather read, different types of cases or work with different types of populations? Find out what you are still excited about and passionate about if it's not what you're currently doing, and try to make that happen in your job. Also have good work-life balance. Look at things internally that you're passionate about and enjoy doing, whether it's cooking or traveling or running, exercising. Make sure you continue to do those things. Don't give up on those things that bring you happiness and fulfillment. Make sure that your relationships are in good check. Make sure you have a good support structure with your friends, family members, and significant other. And then secondly, I want to mention healthcare organizations. Perhaps look at the workplace environment. If you see that there's maybe something that could be creating burnout, like maybe colleagues not being respectful of each other or fair or valuing each other, perhaps talk to your colleagues or talk to the leadership in your group and say, I think this is an issue and it's creating burnout, and maybe come up with some solutions for how you feel that there could be a better, fair environment for your workplace. I think it's important too to recognize physicians and when they do something good, say, great job, that was great that you did on that case. And if you see that your fellow colleagues are demonstrating burnout, look at maybe strategies that you could intervene early on to keep your entire group healthy. So what you're going to see actually on the right hand of the screen, this is an example of another tool that you could use for burnout. And in the ACR, we do have something called the Wellbeing Program. And as you can see here, I'm discussing a little bit about we have a survey you can take that will assess whether or not you have burnout. We also have a toolkit and curriculums to help you cope with burnout. So toolkit and wellbeing curriculums, the ACG and the Align curriculum. This is just the ACR, but just one resource that you could use to perhaps assess for burnout and see what you can do about it. And lastly, I just want to mention on the next few slides, since we've been talking about leadership and I've been giving you some tips on things you could do at each stage of your career to develop leadership, some other resources that you could also use beyond what some of the things I've suggested for you. So number one, you could look for a leadership course. And the ACR, we have with our Radiology Leadership Institute, we have something called the Summit, which is a course we offer every year. And it's a great way to learn leadership skills. We talk about all different kinds of topics, how to brand yourself as an example. But this is one thing that we do. But there's other courses out there too. And I listed a few that I found. For example, Harvard has a leadership development course. The AAMC has a leadership course. CHOP also has a leadership course. These are just some examples. I would encourage you, if you are interested in leadership courses, perhaps to look at your demographic area to make it maybe perhaps easier for yourself about if there's an on-site course you want to take, or some of these courses are also available online. So you could also consider doing them online if there's a course that you're really interested in. Secondly, beyond courses, you could look at texts. And here I have listed some books that our leadership and the ACR have used that they thought were beneficial in them becoming strong leaders. So John Maxwell here on the left, he has written several leadership books. And here's one, The 21 Irrefutable Laws of Leadership. That's one you could consider reading. How to Win Friends and Influence People by Dale Carnegie. That's another good one. 7 Habits of Highly Effective People by Stephen Covey. Again, another great book about leadership. And then I've got a few others listed over here as well. And thirdly, what you could do is just general observation. I have listed here some individuals who you may or may not agree if they're good or bad leaders, but you can't deny that these are leaders. So perhaps you could just kind of look around you. It may not have to be a celebrity. It could be somebody that you work with, on the wards, or you've seen giving lectures at your medical school, but somebody that you respect and you see as a leader. Kind of watch them and see what their traits are and how they respond in different situations and learn from them. And that's going to help you develop your own leadership skills. So I just want to end with this, a few questions to think about. So I want you to really think introspectively on what are you doing right now to build leadership skills? Are you participating in any sorts of committees or getting involved with societies? What are you doing right now? And secondly, what can you do to continue development as leader? So look at what you're doing right now. Look at what you could be doing right now to develop as a leader. Look at what sort of traits you want to become a valuable leader. Again, it could be by observing others. It could be by reading books about good traits. Whatever it is, think about traits that you want to incorporate internally. What is your vision for your career? And I want you to think about not necessarily next week or next month, but to think in the long term. Where do you want to be? What is your goal 5, 15 years down the road? And think about what you need to do to build things now to be able to get to point B. So with that, I'd like to thank you for your time. And right now we're going to move on to the Q&A session.